Final list of 12 symptoms to COVID-19 coronavirus. The Centers for Disease Control and Prevention (CDC) added 3 new symptoms on the symptoms of coronavirus. Over the recent days, various media outlets have reported on these the following added or new symptoms: congestion or runny nose, nausea, and diarrhea. NPR said, the expanded symptoms list could prove important because with a limited number of test kits available, typically those seeking a test must first show symptoms. A fever and a persistent cough are the most common symptoms reported by people with COVID-19, according to a major new review of dozens of studies from around the world. Other major symptoms include fatigue, loss of smell and difficulty breathing. These findings back up the list of symptoms that the World Health Organization (WHO) issued when the pandemic started, as well as those currently listed by the U.S. Centers for Disease Control and Prevention (CDC). These additions have brought the total on the list to either 11 or 12 depending whether you list fever and chills separately. Here is the list: 1. Fever 2. Chills 3. Cough 4. Shortness of breath or difficulty breathing 5. Fatigue 6. Muscle or body ache 7. Headache 8. New loss of taste or smell 9. Sore throat 10. Congestion or runny nose 11. Nausea or vomiting 12. Diarrhea. This list shows how difficult it can be to identify someone with the infection without proper testing. All of the 12 symptoms on the CDC list could occur with many different diseases and conditions. Therefore, don't use the CDC's list alone to determine whether you have a COVID-19 coronavirus infection. It's not a replacement for testing. It is not a replacement for a doctor reviewing your history and examining you. At the same time, don't use this list to rule out a COVID-19 coronavirus infection. Just because you don't have any of the symptoms listed doesn't mean that you aren't infected. So currently, you can never really say for sure that you aren't infected and contagious. You can't say, "Oh, I don't need to wear a face covering to protect others from me because there's no way that I can be contagious." Well, you can say it, but you'd be incorrect. So everybody should take precautions against spreading COVID-19 to others, including wearing a mask, whether they have symptoms or not. To ensure you don't spread the disease to others, stay home, and if you must go out, wear a mask, practice physical distancing and keep your hands clean. Also, be alert to all the possible symptoms of the virus. If you develop these signs of COVID-19, stay home, isolate yourself from others, and reach out to your healthcare provider. Thanks for watching. Please share, comment and subscribe.